Hi everybody, it's Shannon. I thought I'd give you an update. I had my surgery on June the 3rd down at Emory, and Dr. Scoey was my surgeon. He's an orthopedist, and he said by the time they got in on June 3rd from my MRI results that were taken probably like May 22nd. So between that about week, that my bone in my arm had broken. So, the fix for that is to go put the rod in anyway. So this is surgery that I was going to have. So I'm glad I just went ahead and had it done. I did have to spend the night in the hospital on the 3rd, that Monday I had to spend the night. And then I got to leave on the 2nd, or the 4th, sorry. All the nurses that I had at Emory were fabulous, from pre-op straight through to, the floor nurses. They were all just wonderful, wonderful people. The Dr. Scoey, he works at Emory, and so he is also a professor. And I knew that he had a new crop of rotation. His newest rotation of people came through, because whenever I was at my consultation back in May, I had asked one of the students who came in to have me fill out forms and stuff like that. I asked him, are you going to be in the operating room? And he said, only if you have it done before the 3rd, because that's when we switch over. So I knew it was new people that were in there. For as down-to-earth and wonderful bedside manner as Dr. Scoey has, the polar opposite of that would be every single student of his that I saw. And I put that on my survey, and I will discuss it with them if they happen to be there. I hope they are, when I go in for my follow-up appointment. I was blown away by the amount of arrogance by these students. It was truly unbelievable. And for that reason alone, I will absolutely try never to have another surgery at Emory again, because I just can't take them. After the surgery was over, they took me off all of my oncologist's pain management plan that we had gotten all settled and all was well. And they put me on a minimal amount of things that, I told them, I said, I live on more pain medicine than this, just to get through the day, not after having you open up my arm and, stick a rod in there with screws and whatnot and sew it back up. This isn't going to cut it. Oh, no, it'll be fine. Well, no, it's not going to be fine, love. As somebody who lives in this body, who knows what it's like, I can tell you right now this is not going to be fine. Sure enough, it was not fine. And, you have an issue always comes up at the most inopportune moment, which is always going to be in the middle of the night, which is what happened to me, and it was absolutely horrendous. And when the next little doctor came in to ask me about it, I was like, this isn't cutting it. Oh no, I can't give you anything else. I'm like, really? And in my survey, I put, if you plan on, being a surgeon to oncology patients, you need to go back to whatever rotation that's covered in, because I think you must have failed that. It's just wrong. You need to learn what pain management for an oncology patient, I'm sure, looks vastly different from pain management of just a regular normal patient who doesn't have cancer. I'm sure that's true. None of my friends walk around on, the stuff that I have to walk around on. So anyway, I'm going to stop venting now, but I hope all my little doctors are going to be there when I go in for my follow-up, because I'm certainly going to explain this to them. And I will definitely be telling Dr. Scoey about how none of them should have been in there if they knew that little amount, that it was just horrible. To make a patient feel judged, that's just horrible. No, I've got bigger things to deal with than that. So that was the 3rd and the 4th. And then whenever I came home, I ditched whatever it was he gave me. I don't even know what that man gave me, sent me home with. And I went back on my oncologist pain management plan, and it took a couple of days for it to kind of kick in and catch up to the pain that I was still in, before I could kind of cut back on that to the minimum dosing amounts that I had been on before. But I mean, for a good 2-3 days after I got sent home from the hospital, I was on the maximum dosing amounts that my oncologist had let me have, and that's how long it took for just to get that under control. But now I'm back to like definitely my lowest amounts, and during the daytime I can just take Advil. That's generally enough. Sometimes I need a little something else like Percocet or something, but usually I only need that at night, and I'll still wake up with the pain. So, but it's getting better, which is really nice. I think, with every day, time heals so much. And so that's kind of nice. What else? Today I went in for chemo, and I got my blood work done, and I was getting some of my fluids and whatnot through my IV when my oncology nurse came over and said that they didn't like the way my kidney and liver enzymes still looked. It was the same as it was the last time I'd been there. But she said, just with the cumulative effects of chemo, they wanted to wait until next week to see if they got a little bit better, because time heals. And so I'm going to go in on Monday and have blood work drawn. And then if all is well, I'll come in Tuesday, Thursday and do my chemo on Tuesday, my big infusion on Tuesday, and get hooked up to my pump, and then be unhooked on Thursday. So that doesn't sound too bad. And quite frankly, given the fact that I still wake up a lot at night with the pain from the surgery, it's going to be kind of nice also not to have to deal with Penelope too. So I'm kind of excited about that we're just going to prolong that a little bit more, and that'll be okay. So that's about really my update right now. I go back to see my Dr. Scoey the same week that I have my follow-up with Dr. Abdallah about my liver to make sure everything is still okay. And I'm supposed to have an MRI with him, but now that I have this titanium steel rod in my arm, I don't know if that's a possibility or not, since they always ask you about everything magnetic and metal and all that kind of stuff that you have in your body. And they freak out enough over the port with an MRI. I don't know what they're going to do when I tell them I now have a rod in my arm. So I don't know if we can do that or not. I guess we'll find out. So until then, I will talk to y'all later. Stay strong, be positive, and bye everybody.